Welcome to the February edition of Healthy Steps. Since it's February, we're going to talk about heart health. I'm here today with Dr. Elizabeth Altizer, our local OBGYN expert, and we are going to talk about the connection between heart health and birth control.
Absolutely, birth control can affect your heart health, and it really depends on what kind of birth control we're talking about. In general, there's a wide range of types of birth control. Number one would be the birth control pill. Most birth control pills have estrogen and progesterone in them. Not all, but most. And estrogen particularly can affect your blood pressure. It can increase your risk of having a blood clot or stroke. However, that risk is still lower than your risk is when you're pregnant in general for the healthy population. So if your risk of having a blood clot or a stroke with no medication is here, and if your risk when you're pregnant, it's here. When you're on birth control, it's here. And you're preventing a pregnancy, which has a lot of other implications for your health and has other risks for your health as well.
Been in that boat. There's some risks. Why do you think we don't talk about it when we're young? Is it just because the risk is so reduced for heart complications because we're young? So the birth control versus heart health?
Unfortunately, it should be talked about because any medication and their risks should be talked about. And I do think there's a range of people being thorough when they counsel on birth control in general. But I think there's not as much of an emphasis on it for the general population that don't have medical problems. Now, if you were to come to me and wanting to talk about birth control and you have a history of high blood pressure, that's a contraindication for you to take a birth control pill with estrogen in it when you're over the age of about 30. When you're younger than 30, your risk for blood clot and stroke on an estrogen-containing pill, even with high blood pressure, is not as high, but still probably should be avoided. But it's definitely contraindicated the older you are.
So it's important to talk about our overall health with our OBGYN when we're talking about birth control, because there are so many factors to help us determine what's best.
Absolutely. Even a big one that's been going on lately is the popularity of vaping.
You know what? That was one of my questions. It's like smoking different than vaping when it comes to risk factors.
So if there's nicotine in your vape, I treat it the same as smoking with birth control. And in general, vaping is going to put you at a higher risk of having a blood clot when you're on an estrogen-containing pill than when you're not. So the lower risk thing to do if someone wants to take a birth control pill, if they're vaping, is to take a progesterone-only pill.
Okay, and is pill the best option if you are a smoker, or should we look at maybe other options? Does the risk remain the same, pill versus IUD or patch?
It's a great question. So there are other options that are progesterone only that are not pills. So the implant that goes under the skin of your arm, Nexplanon, is progesterone only. So that would not increase your risk of blood clot or stroke if you smoke or have high blood pressure. The IUD, there are hormonal and non-hormonal types. Both of those would not increase your risk of blood clot or stroke. And so those are also good options for people that want a longer acting birth control. There's also obviously an increased efficacy with the long acting birth controls because there's less human error involved.
That is number one importance for me. I need it to be long acting and human error decreased.
Yes, because if you forget to take your pill, it is not going to work to prevent pregnancy. You can forget about your IUD and it's just going to sit in your uterus for 8 years.
She has done me well. Effective, long acting, but reducing the risk of blood clot where we can if they're a smoker.
So when you're pregnant, your levels of estrogen and progesterone, your hormone levels, are so much higher that your risk of having a blood clot is still going to be higher than when you're not pregnant and just taking an estrogen-containing birth control pill.
Okay.
So still, for the healthy population, taking a low-dose birth control pill is less risk for your heart than being pregnant would be.
Okay. So do you think we don't talk about this as often because when you're on birth control, you're so much younger than the risk factor for cardiovascular issues when you're an older female? Do you think that that's the correlation there as to why we don't talk about it versus heart health when we're older?
Correct, because at a young age with no medical problems, your risk of having complications on a low-dose birth control pill are still pretty low. Now, your counseling should still be thorough and include all of your medical problems. So if someone does have high blood pressure at a young age, we are absolutely talking about it. But it wouldn't mean that you absolutely cannot take a birth control pill. But it is a conversation that we have based off of each individual's histories and medical problems.
So it's really important to be honest about your medical problems, your family history, so that you can really talk about the best option for a long-acting, effective birth control.
Absolutely.
We'll be here as long as we can, giving you all the information we can about women's health and reproductive health, trying to create the most informed community we can. Send us your questions, and remember, be kind to yourself and be kind to others. It's that easy.